So we can't talk about birth preparation and our plans for pain relief during labour without talking about the epidural. So many mamas opt for the epidural, and so many of you think that I must be anti-epidural as a birth worker myself. However, I do actually believe that the epidural can be a really powerful tool when it's used at the right time and when we go into these experiences with our eyes wide open. And so with everything else, there are pros and cons to an epidural. Some of the pros can include being fully present when your baby is born into the world. When we are laboring without pain medication, sometimes we are just so in the zone and so in our bubble that we aren't quite in the room when our babies are born. We're in this whole other birthing world. And so if you want to be really present and very aware when your baby's being born, that can be a really nice benefit of using an epidural. One of the other things that can be really nice is if you are maybe experiencing a very long or tiring labor, that the epidural will allow you some time to actually rest and to sleep. So it means you're not quite so tired when your baby arrives into the world. And then of course, it can be useful in certain scenarios, perhaps when we have a background or a lot of experience in maybe gymnastics or horse riding, and we haven't done the work to help relieve tension in our pelvic floors. A lot of women don't realize that actually it's our uterus that pushes our babies down and out, and that our pelvic floor simply has to soften and to yield to allow baby to come through. And so in some scenarios where we are carrying a lot of tension in our pelvic floor, and we've been doing a lot of pelvic floor work to really increase the tone there, and haven't also been doing that work paired alongside those exercises to help our pelvic floor to soften and to relax and to release, what can happen is baby can get to that point where it meets the pelvic floor, and it's really, our babies are always trying their best to find the way through, find the easiest path, the path of least resistance. And so we've got a very tight pelvic floor there that's not allowing baby's head to come through. The use of an epidural can be very helpful because it helps everything to soften and to relax. Now that's a catch-22 because it can also cause issues then relating to pushing. So there are some of the pros and the cons. With everything that we talk about, we have to appreciate that there's another side, there's a flip side to every eventuality. And so if we choose to go down the route of getting an epidural, we have to know that there are other things that come with that. Immediately, we are put into sort of a higher category, a higher risk category when we talk about our labors. So perhaps you had been, low risk your entire pregnancy, and then you choose to have an epidural. That means that immediately our care providers will want to keep a closer eye on baby. The main reason for this is that when we accept an epidural, likely mum will have a drop in her blood pressure, and this carries through to baby. So the same medications that we are accepting will go pass through the placenta to baby. And this can cause an increase in what we call decelerations, where baby's blood pressure and their heart rate drop. So we want to keep a nice close eye on that, which means CTG monitoring, where you will have 2 little monitors and these belts around you for the entirety of your labor until baby is born. So not only do we have constant or continuous CTG monitoring, we also won't be able to feel when we need to empty our bladder. So you will have intermittent catheterization, whereby our bladder is emptied for us, which can feel very strange, and a lot of women don't realize that that's a part of their journey. Another thing is to combat that impact that the epidural can have on dropping our blood pressure. We are given an IV line and a bag of fluids. This means that it's sort of bumping up the volume of our blood to increase our blood pressure, to bring it back up to normal. But it can also mean that our babies are born with an inflated birth weight, which can sometimes lead to a host of breastfeeding issues. Another thing that's worthwhile bearing in mind is that when we have an epidural, we don't have the same freedom of movement. And so we can't as easily mobilize to help our babies move through the pelvis. So we're going to talk about some strategies in a moment that you can use to help make the most of your epidural and to increase the likelihood of you having a positive birth experience. But bearing in mind that your movement will be impacted is hugely important. And then the last thing that I like to talk about is that in view of all of these other interventions that come alongside an epidural, so we've got this sort of cascade of interventions that happen between the IV line, the decreased mobility, the need for a catheter, the decreased sensations, but it also increases our risk of having a forceps, ventouse, so an instrumental whereby our baby needs a little help out at the very end, or a cesarean birth. And so when we go into the concept of choosing an epidural, we have to go in with our eyes wide open. That decreased sensation that we experience means that we are less likely to be able to effectively and efficiently push our babies into the world. We don't feel that natural Ferguson's reflex nudging our baby out anymore. We have to do this with some support, with some guidance, maybe with a little bit of coaching. And with that comes an increased risk of an instrumental delivery, but also an increased risk of tearing and or an episiotomy. And so with our eyes wide open, knowing the pros and the cons, here are some of the things that you can do to help an epidural work in your favor. One of the first things is waiting as long as possible. So even if you plan like, okay, Kitty, I'm taking this course and I still plan on having an epidural, I want you to watch the other modules. An epidural is not a pain relief plan. It is a part of it. And so knowing that you have the tools of acupressure, massage, movement, hydrotherapy, all of these different things means that you can utilize them to help you get towards your epidural. And the further you progress in labor, the further down our baby gets in the levels of the pelvis, the more likely you are to have an aid-free, instrumental-free, smooth birth of your baby. So that's the first thing. Get as far as you can in your labor. Progress as much as you can without the assistance of an epidural. The next thing is mobilizing. So we know that almost as soon as we get an epidural, we are confined to the bed. And so we want to be thinking outside of the box. What sort of movements can we incorporate with the use of the epidural while we are in bed to help our baby to navigate the pelvis, to move through the pelvis? So we're thinking using a peanut bowl. We're thinking rotating like a rotisserie chicken every 20 minutes from side to side. Perhaps we can have enough strength in our legs and with the support of our birth team, get up onto all fours, lean over onto the back of the bed, getting into a position where perhaps we are raising the back of the bed and lowering the legs so that we can let gravity work in our favor, so that our baby can continue to have that lovely pressure downward on the cervix to progress smoothly and easily. And then with that in mind, when we're talking about the epidural, we have to think about what sort of positions we would like to birth our baby in. Perhaps it is side lying. Perhaps with support, you would like to be on your back in a position where our coccyx is free. Our coccyx is our tailbone here, which moves to get out of the way for baby to come through when we're in a physiological labor. However, if we are choosing to birth on our backs, which a lot of mamas do with an epidural, we want to make sure that there is space here for that tailbone, that sacrum to move. And so you might roll up a towel on either side to create some space. You might decide to just go on your side altogether. Even better, so our baby isn't moving uphill, going onto all fours so that our baby can come down through the pelvis and out really smoothly and easily. Since you aren't going to be able to feel how it is as your baby's head is crowning, making sure that you talk to your care provider and think about the ways in which you can support your perineum in view of that. Perhaps it's a warm compress on your perineum prior and as your baby is crowning. Perhaps it's utilizing some counter pressure to help your baby's head come through nice and slowly, utilizing your birthing breath that you've already practiced and asking for feedback. Perhaps it's having a mirror there. Perhaps it's going down and actually just feeling your baby's head coming through so you have something to work against. If our babies can come through gently and not really, really quickly, we are much more likely to have a as minimal tearing as possible. So I'm not totally against the epidural, but as with everything, I think we have to keep our eyes wide open. Thinking about that cascade of interventions that comes alongside the epidural means we go in with a plan, an action plan, so that we can still have a really empowering birth.